She tells you that she has soaked 8 high-absorbency tampons in the past 2 hours. Approximately how much blood has she lost externally? 160 milliliters. Provide emotional support, make her as comfortable as possible, and safely transport her to an appropriate hospital. A ruptured ovarian cyst typically presents with a sudden onset of abdominal pain that can be related to the menstrual cycle. Common signs and symptoms of Gardnerella vaginitis include a fishy vaginal odor, itching, irritation, and vaginal discharge. Common signs and symptoms of infection with the cytomegalovirus include prolonged high fever. During normal menstruation, approximately blank to blank ml of blood is discharged from the vagina. 25-65. Dysmenorrhea that occurs before, during, and after menstrual flow. May signal an underlying illness. If a 17-year-old woman with a gynecologic problem answers your question, is there any possibility that you are pregnant? With a firm no way, you should ask the patient why she is sure that she is not pregnant. If a woman who is being treated with the antibiotic metronidazole for bacterial vaginosis consumes alcohol during treatment, she may develop severe nausea and vomiting. If a young female with a known history of gonorrhea presents with abdominal pain, nausea, and vomiting, and bleeding between periods, she most likely has pelvic inflammatory disease. Implantation of a fertilized egg within a fallopian tube can cause severe intra-abdominal hemorrhage. In contrast to endometritis, endometriosis may present without abdominal pain. In the average female, the menstrual cycle lasts blank days. 28. In the late stage of syphilis, the patient is usually asymptomatic, but damage to the brain, heart, blood vessels, and liver is occurring. Initial signs and symptoms of toxic shock syndrome include all of the following: EXCEPT, cardiac dysrhythmias, identifying and treating immediate life threats. Mittelschmerz is defined as unilateral abdominal pain and cramping that occur during the ovulatory process. Pelvic inflammatory disease commonly affects all of the following organs, EXCEPT: the urinary bladder. Pelvic inflammatory disease MOST commonly affects sexually active women, postmenopausal women are more susceptible to atherosclerosis and osteoporosis. Reiter syndrome is a rare complication associated with untreated chlamydia and is characterized by arthritis and skin lesions. Risk factors for pelvic inflammatory disease include all of the following: EXCEPT, Monogamy. The Candida albicans fungus is the causative agent in vaginal yeast infections. The external female genitalia are collectively referred to as the pudendum. The headache commonly experienced by women during their menstrual cycle is caused by hormonal release. The lesions associated with genital herpes initially appear as small red bumps. The most common cause of amenorrhea is pregnancy. The most common underlying cause of a tuber-ovarian abscess is gonorrhea. The most important aspect in the care of a woman with severe vaginal bleeding is treating for shock and transporting rapidly. The onset of menses is called blank and typically occurs between the ages of blank in age 11 and 14 years. Consider administering naloxone in case she was also given a narcotic drug. What part of the female genitalia is homologous to the glans penis of the male? Clitoris. When conducting the scene size-up of a call involving a gynecologic emergency, it is most important to assess for danger because any scene should be considered volatile. Which of the following conditions is characterized by lack of progesterone and increased androgen levels, and can lead to gestational diabetes and cardiac problems? Polycystic ovaries. Which of the following conditions poses the least risk for shock due to vaginal bleeding? Dysmenorrhea. Which of the following conditions, if it remains undetected until puberty, can result in acute pain, severe constipation, and low back pain at the onset of menses? Imperforate hymen. Which of the following is a potential complication of pelvic inflammatory disease? Ectopic pregnancy. Which of the following is not characteristic of the secondary stage of syphilis? A single or multiple chancres. Which of the following medications would most likely be used in the pre-hospital setting to treat some women with severe premenstrual syndrome? Glucose and fentanyl. Which of the following questions is the most important to ask when obtaining a patient's gynecologic history? When was your last menstrual period? Which of the following statements regarding ectopic pregnancy is most correct? In ectopic pregnancy, a fertilized egg implants somewhere other than the uterus. Which of the following statements regarding endometritis is correct? Untreated endometritis may result in septic shock. Which of the following statements regarding the human papillomavirus is correct? HPV has been identified as a causative agent in cervical cancer. Which of the following statements regarding toxic shock syndrome is correct? Patients with TSS may show signs of liver failure. maintaining her airway, and providing ventilatory assistance. Within a few days after having a therapeutic abortion, a 33-year-old woman presents with malaise, fever, constipation, and pelvic pain. Her blood pressure is 124/84 mm Hg, pulse rate is 104 beats per minute and strong, and respirations are 22 breaths per minute, and regular. You should be most suspicious for endometritis. Ask the patient if there is a friend you can call with whom she can stay. Narcotic analgesia. Apply high-flow oxygen, visually inspect her vagina, and cover it with sterile dressings, keep her warm, begin transport, establish at least one large-bore IV en route, and administer enough crystalloid fluid to maintain radial pulses. A ruptured ovarian cyst.